Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, hello, Metro Detroit. This is Dr. Joseph Kanu of Rochester Chiropractic Clinic.
And this is Dr. Jeff Haddad of Rochester Advanced Dentistry.
Yes, and we are broadcasting live tonight. And if any of you have any questions for Dr. Jeff concerning dental needs,
yes,
please feel free to call. You can call our office, 248-656-1011, and Steve will put you through. And Dr. Jeff, what are we going to talk about tonight?
Well, it's a little unorthodox. I want to. Yeah, well, I like to switch it up on you a little bit.
Uh-huh.
It's a very timely topic, but usually I don't like to. I don't know. Propagate legal type action, especially in the media, okay?
Legal media action?
Yeah, I mean, it's although, I know that we have a very prominent lawyer that you're very, friendly with.
I didn't want you to expose that I've been in jail, over the weekend again.
Well,
what do you
listen.
get? Go ahead, say it.
That's all public record,
Yeah.
Joe. I mean, our listeners, they deserve honesty. No, actually, this is more along the lines of, it's very dentally related, but I'm not sure if you heard, the country singer LeAnn Rimes.
Yeah.
You familiar?
Right.
Okay.
Yeah, right.
It came across, of course, me being a dentist, but on Valentine's Day, she decided to file a suit against her dentist for allegedly causing a lot of issues, a lot of gum inflammation, chronic bleeding, and more importantly, or as importantly, a TMJ problem. Now, we have talked about TMJ disorders in the past. This constitutes a, daily jaw pain, daily headaches, migraines, popping, clicking. It's a myriad of problems that fall under this umbrella of a TMJ disorder. And believe me, I don't know if it's true or not as far as LeAnn Rimes goes. That's not the point of tonight. The point of tonight is that I don't think people realize that things like that really can happen. And it can happen because of dental work. There's a lot of people in this world, Joe, that go through with a very fragile bite. They have they've been accommodating. They are living day to day with symptoms, but they're living life. Maybe not to the fullest quality of life, but they're doing okay. Maybe they need some over-the-counter medications every once in a while. Maybe they get a headache here and there. But what these people don't realize is that anything in life, whether it be trauma, an accident. I know you've had your share of patients who have had car accidents, things like that. Clenching and grinding, severe, deterioration of a bite, or even dental work can push these people into a pain spiral that they could have never imagined. And unfortunately, these are the people that I see on a daily basis because, as you know, at our practice, we focus on a lot of TMJ problems, a lot of headache and migraine treatment. And my goal tonight is really to let people know, first of all, some of the signs and symptoms that if they are exhibiting these, then they may have an underlying TMJ problem.
Right,
and to make them aware of the fact that they need to educate themselves on this, and whether they, educate through myself or another dentist that they know, they need to educate themselves and their dentist. Because I would hate for something like that to happen to them. And without the proper knowledge, a dentist, whether it be me or somebody else, can't manage this bite or these symptoms. And you could be in a quote unquote Leanne Rimes situation. And again, that's
Right.
really it's kind of tongue in cheek that we're talking about the Leanne Rimes thing, but I think it points to a lot of things that I think our listeners are really can learn a lot from.
Well, great. Sounds like another great show.
I hope so.
Yeah.
We are going to find out.
All right. So we're going to start with a scripture reading. And Peter, we're going to read, James. Let's read from James, chapter 1. Perseverance and trial. I think this is fitting with the Leanne Rimes
There you go.
trial coming up, okay?
Wow.
Consider it all joy, my brothers, when you encounter various trials, for you know that the testing of your faith produces perseverance. And let perseverance be perfect, so that you may be perfect and complete, lacking in nothing. But if any of you lacks wisdom, he should ask God, who gives to all generously and ungrudgingly, and he will be given it if you ask for it. And but if you should ask in faith, not doubting, the one who doubts is like a wave of the sea that gets driven and tossed about by the wind. That's what it's like when we don't have faith, right? We're being tossed to and fro, indecision, can't make the proper decisions. Mm-hmm. We need to have an ask in faith. For that person must not suppose that he'll receive anything from the Lord if you don't have faith, since he is a man of two minds, unstable in all his ways. So we need to have stability and ask in faith and not whine when we have perseverance and trials. We need to persevere through it and have faith that God is going to give to us all generously and ungrudgingly. Isn't that wonderful? Mm-hmm. Ask and you shall receive. Yeah, Leanne Rimes is filing a lawsuit, against her dentist. How would you like to be that dentist,
I'm
Jeff?
very happy that I'm not. And again, it's unfortunate because I don't know what truth really is in
right,
that.
Right.
I really don't. But the scary thing is that things like this can happen. And again, not because the dentist does anything wrong. It's because there are people out there that have the potential and are prone to this pain spiral.
Right.
And they don't realize it. Now, I talk to patients daily who say, "Oh, well, no, I have no symptoms. I feel fine." But I'm looking in their mouth and I'm seeing, extreme wear and tear, the divots along the gum lines, which are called abfractions, that's a clenching, grinding thing. That is not because of brushing your teeth too hard.
Well, you talked about it sharding off.
Correct.
Shards start coming off of your tooth.
Yep, just shearing off because of it's bad engineering. Okay, I mean, teeth are coming together in a destructive way. And I'm sitting there looking at these people's mouths, and I'm hearing the popping and the clicking in their joints behind the ear, and like, "Oh no, I feel fine, doc." I said, "Well," and then I delve in. "Have you ever had any headaches?" "Oh yeah, 10 years ago I was having migraines all the time, but that's all better now." "Oh, well, what'd you do?" "Oh, well, I did this or that or, and they move on. And it's not that it's fixed itself, and they still probably get their headaches here and there, but they're living life. Human beings are pretty tough. Talk about persevering, all right? We're talking about persevering here,
right.
And I mean, that's really what most of our patients do. Unfortunately, I think that the misnomer is that they've made it this far in life, okay, and they think that the next 30, 40 years they're going to be fine. And that's just unfortunately, that's not the fact of the matter. I mean, it's not the truth. Just because you've gotten to this point in your life, and yes, you're a severe grinder, and yeah, have you worn some teeth down, and yeah, you get headaches, but they're not too bad. I can take some Advil, or every once in a while, doc, yeah, I got to take a Vicodin or something like that, and they think that that's normal, taking narcotics for this, but this is what people do, and they think that they can manage this for the rest of their lives. That's not the case. And unfortunately, a person maybe, again, allegedly, like Leanne Rimes or somebody else, they can be pushed over the edge. All of us have this, what I call a stress bucket. Okay, and you've got this bucket, and every day, you're getting more water put in there, right? A little bit more water. Who knows? Maybe life is tough. job market's tough, clenching and grinding a little bit more, you're hunched over your computer more, who knows? But you have all these glasses of water into the stress bucket. Well, eventually that's going to overflow. If you're lucky, you're going to keep it at bay, and maybe you're going to do some things to hold some things off, and you're going to go through life and be fine. But that's not the case for a lot of people. And if you get pushed over that edge, if your stress bucket gets overflown, well, we've got a problem. A lot of times it's my problem because a patient comes in with, literally, I've had people with ice packs on their heads and they were, truly fine the day before. How could this happen all of a sudden, Doc? Well, it didn't, okay? It's been going on for a long time. You've accommodated, and you see this all the time. I know you do. In your patients.
I'm going to interrupt you. I just had a patient today who's, we treat a lot of vertigo patients.
Right.
I have a patient never has had vertigo. All of a sudden, was laying in bed today, turned from her right to the left, and she said, I felt I was falling out of bed, like the mattress went up in the air and I was falling down. Never had it. Now, a lot of time, we have patients like this where we just do an exam, and all of a sudden, oh, you hurt me. It's like, I didn't, all I told you was turn your head right and left.
Right.
It's unfortunate that it can be the straw that breaks the camel's back, or you're just in the line. Did you do something wrong? Yes, that could be a factor, but it could be you were perfectly fine, and you were just like this lady I had today who just rolled from her right to her left and is having severe vertigo. It just came on like boom, out of nowhere.
Yeah,
but usually we as physicians see the signs
if you're paying attention. I'll tell you, Joe,
So I want to know these signs.
Well,
Jeff,
and I think that's the important.
Run into TMJ.
That's the important thing.
Don't wait for it to happen.
I want, unfortunately, the majority of dentists. I can tell you the way I was trained in dental school. I was pretty much not trained to treat TMJ. No dentist comes out of dental school knowing how to treat TMJ.
Wow.
It's just not taught.
Even now.
No, there's
even your buddy that's your protege that's coming through the ranks?
No, he doesn't have a clue. Marco, Dr. Tarodi, doesn't have a clue. The reason, it's not because the dental schools are bad. It's because they don't have enough time to focus on something like that. It is so involved. There's so many things that you need to be
aware of
and overly educated on to treat a TMJ situation that they don't have the time. Now, if you continue on and do a lot of the continuing education courses like I do, I've completed several curriculums based on what's called neuromuscular dentistry that treats the TMJ.
Well, where were you this weekend, Jeff? You were studying?
This weekend I was actually down in beautiful Parkersburg, West Virginia. Not really the beautiful Mecca that you want it to be. I was studying the whole time, believe me. It was It was actually a 3-day course on and it was. I'm glad you brought this up. I didn't even tell you this too. Way to segue into our show. But it was TMJ related, and what it is, we've talked about bad bites.
Yes.
And we need to find people's harmonious bites based on their proper muscles of the face and where their jaw position is, where their muscles are the happiest, and their joints and teeth are in the proper position, all in equilibrium. Well, a lot of times after I find a person's bite, we make what we call a neuromuscular orthotic for them. It's an appliance that goes on their lower teeth. Most people don't even know that the person has it in their mouth, and it supports their jaw in a position almost mimicking teeth, as if their bite was maybe 20 years ago when they were comfortable, or maybe the way just God intended it to be, but it never was.
So does this appliance actually elevate the teeth height?
A lot of times
it's wearing down.
Exactly, yes. A lot of times it does. It elevates it. It gives it the proper support. And a lot of times a jaw is actually pushed back towards the ears because things have worn down and the chin's almost getting pushed back.
Right.
And you kind of got that retruded look.
Boy.
Well, this will bring things down and forward and comfortable. And this particular class that I was in was actually showing me from an orthodontic standpoint, braces and other things, to move these teeth permanently into that proven, comfortable, painless position. So you've got the first step, which we've talked in the past. For those of you who've listened, I refer to my orthotic therapy. The first step, which is phase 1. If somebody comes to me with a TMJ problem, with a migraine problem, headaches, and it's related to their bite, we want to do things reversibly and conservatively. And so that's what's called phase 1 orthotic therapy. We find their proper bite based on my computer system that measures their muscles. We find that proper position, and we make that appliance. For 3 to 4 months, I am adjusting that appliance. People are coming in usually once a month for the most part, and I'm checking their bite, adjusting them, letting their body guide me, because that's the reason that's successful and predictable. I'm letting the person's individual body guide me to where they want to be. A lot of dentists, unfortunately, and the way I was taught in dental school, is you make an appliance, you jam it in there, and you say, all right, Miss Smith, go get used to that.
Yeah.
I mean,
learn to live with it.
Right. Who am I to say that I know what you or another patient is comfortable? And that's why this technology that we have is so it's so important, because I'm measuring a person's actual physiology, and it's telling me where their bite should be, based regardless on what their teeth are right now. Because unfortunately, you get to a certain point in your life, your teeth are not what they were,
Right. Sure.
growing up. And so after that, after we get things comfortable, after phase 1 is done, the person is essentially pain-free. The majority of people have no symptoms. If anything, they are so much more comfortable than they ever have been their love and life. And they either choose to continue with this appliance and use it as needed, or they may choose to permanently change their teeth. One way would be orthodontics, like we just talked about, which is what this course I was just at was for, and it's about managing the bite, moving the teeth into the proper position that we've already proven. Or there are a lot of people who have a lot of older dental work, failing dental work, and if they want to permanently be rebuilt to that comfortable neuromuscular position, we may have to do some restoration, some crowns, things like that. Again, rebuild things to where they really should be, the bite that we've proven. And so it's something that I think. I mean, we want to talk about the science. We kind of want. We'll take a step back here, but that was what I was there for, as far as training goes, and that's the way that we treat patients when they have these symptoms and come to me for help. Now, for the people who maybe don't know they have a problem.
I think our patients know now TMJ, temporal mandibular joint, when you have pain in the jaw, where the jaw, your lower jaw, connects up in front of your ear.
Correct, right in the skull. Yep, correct.
A large amount of proprioceptive fibers there can cause headaches. What are the other symptoms? Headaches, ringing
jaw
in the ear.
pain, ringing in the ears, ear congestion. Hey, you mentioned vertigo also. Vertigo is a very big symptom of a TMJ situation, because if you've got tension in these facial muscles, well, what's right there? The inner ear. When the inner ear and the balance portion of the inner ear is compromised due to nerve compression, inflammation, tension in the muscles, we can have a vertigo issue. Jaw pain, clicking, popping. A lot of people say, oh, yeah, my jaw clicks, and they kind of laugh at it. And it's good when they don't have pain, but that doesn't mean it's not pathologic. I mean, these are things that, again, your dentist should be paying attention to. I mean, every exam I've ever done, person comes in, and whether it's myself, my assistant, or my hygienist, they're checking for any type of joint sounds, because that's a big red flag for us. Other red flags, severe wear. If you're a big clencher and grinder, you are very prone to getting thrown into a TMJ situation, mainly because of the powerful movements, grinding, clenching, tension that's caused mainly at night can throw you into that pain spiral there, And as our teeth get worn down, as our bite gets more compromised, your bite becomes, it's already started as non-ideal. It gets poorer and poorer and poorer and poorer. And if you're one of those lucky people who get through their lives without any type of symptoms, well, God bless you. I hope that is you. But the sad truth is that the majority of people do not. Most people that we treat are women 35 to 55. Okay, that is the biggest patient pool for TMJ. patients. Now, don't get me wrong.
Is that because men give the women stress?
I know the women are sitting there, nodding their heads, thinking that. Actually, I used to make a joke and say, I think women are just smarter than us because they seek help.
Yes.
But the truth of the matter is, unfortunately for women, estrogen aggravates pain. Testosterone can help diminish it.
Lowers
okay,
it? Really?
It can offset things. And,
Wow,
but,
Jeff, that's the first time I've heard that.
Yeah, that's been shown a lot as far as what can adding and subtracting factors. And don't get me wrong, I've treated many men with TMJ issues, but the majority are women. And I give these age ranges. Don't think that you have to fall within there. I've treated a girl as young as 17 and another woman as old as 72.
Wow.
Okay, so it could be anybody. It could be any time.
It can happen at any time.
Back to the Leanne Rimes thing of why we're talking about this. Dental work can push somebody over the edge. Even the smallest little filling. I've had patients come to me, and again, they're thinking that their dentist did something wrong and all this stuff. That's not the case. They did a simple filling. The filling is fine. The problem is, and you can have this debate all day long, why didn't the dentist know that this could happen? Well, we're not all knowing.
Right.
We can see signs and symptoms. We don't know. Even when I see somebody with signs and symptoms, I say, well, we're going to do this, and we're going to manage this bite. But I hope you know that you've been told in the past that you clench and grind and things like that. No, nobody's ever told me that. Oh, that's where I take a step back and I start to educate. Because patients need to know that but there is a potential for this, and any dental work can aggravate that. Now, again, I go over and beyond to manage things and make sure that nothing like that does happen. The nice thing is, if it is to happen, I have been trained to correct things and, again, manage things to alleviate those symptoms. Unfortunately, I wouldn't say unfortunately, a lot of dentists don't want to treat that, and that's their prerogative. The beautiful thing about dentistry or medicine is there are some focuses in your practice, and there's other ones that you refer out. And you don't have to be the hero, and that's okay. I just have. I've been treating this for a very long time, longer than anybody in the area. I enjoy it. It's very predictable for me. It's very fulfilling to me because these patients, they've unfortunately been everywhere else. They're looking for help, and a lot of people don't know how to effectively treat a TMJ situation, a headache situation, a migraine situation. And for us to get them out of pain as predictably and successfully as we do, it's fun for me because these patients appreciate it, and it is it's a great service. But there's a lot of dentists that don't want to deal with that. They have other focuses in their practice. So the point of this moral of the story, if you are a patient who is listening tonight and some of these symptoms are ringing true, or these signs, no pun intended, these signs that you've been told that you grind your teeth, things like that, please either seek some education. If you'd like me to take a look, give you a full exam, I'm happy to. You can go to our website at rochesteradvanceddentistry.com. You can call our office at 248-656-2020. I'm not sure what it is about this month, but we've had a lot of TMJ patients finding us, and it's been great. I've had two people who have been already treated by some other quote-unquote TMJ experts without any success. Luckily, they found me, and the treatment that we're doing is a different approach than what they've been had.
Different approach.
And they're starting with me, and they are starting to see results. So, again,
that's good. So if you've been treated before and unsuccessfully, don't give up.
Don't give up. I mean, really, please give myself or somebody else the opportunity because there are a lot of approaches. Obviously, I've been doing this a long time. My approach, in my opinion, is the most predictable in my hands, and we get great
It's nice that
success.
you have that much confidence, Jeff.
When you see the same types of symptoms in patients for many, 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 many years, you see what works, you see what doesn't work, you see what you can help, and you see who you can't. I will never claim to say that I can fix everybody. I just know who I can help. That's why we do these screenings before. We have these consultations before. We do a very thorough exam with measurements. I'll be able to tell you if we can help you or we can't. I don't want to waste anybody's time. I don't want to give anybody false hope. But we can identify you as a person who will have success with our treatment or somebody who won't. So there is hope, and there is help out there for you. And for those of you who have had these issues in the past, please educate yourself and or notify your dentist anytime you have to have any type of extensive dental work, because they need to know so that they can either manage it, or if they're uncomfortable managing it, refer you to somebody who can.
Hey, so Jeff, this orthotic that you can make, you said sometimes you can make an orthotic.
Right.
And you wear it just at night, you wear it all the time.
During that first 4 months, it is a 24/7 appliance. You take it out to eat. Now, when I say 24/7, I know human beings, and I know they're not going to keep it in for 24 hours. But the best and fastest results is you wearing it as much as possible, because the point is for your body to believe it's in this bite permanently. That's the way that these symptoms resolve themselves quicker. The more you wear it, the better it is. After that time, if you want to wean yourself off it to nighttime use or just certain times during the day, then that's your prerogative. But during that first, therapy phase, we need to get that body going, reprogrammed, so it starts feeling better.
Okay.
That's a great question.
So for TMJ, if you're wearing your teeth out, you have ear pain, ringing in the ear, headaches, jaw popping, congestion, probably because you're shutting down the inflammation, and it can lead to sleep apnea.
Absolutely. Right? We didn't even open up that can of worms, but you're right. I'll throw out that stat. 75% of all TMJ patients have sleep apnea as well.
Wow.
Think about that.
So
They're the same people.
And if you do have the jaw popping, you are definitely it's not just a funny thing. Even though it's not causing pain, it can wear out the jaw joint.
No question about it.
The disc on the top of the ramus of the mandible.
Yeah, you got it.
And you might not have any pain now, but at any moment it can become a problem. So it's always good to go to an expert who knows what to do and how to see these signs. So don't put it off. If you've tried another dentist and have not been successful, Dr. Haddad might be the answer. Remember, you can listen to all these shows on Simple Truths for HealthyLiving.com. We are on Monday through Friday. Jeff's is also on. We're on WRDT, an AM station, at 11:30 in the morning.
Yep, every Wednesday.
Every Wednesday. So until we see you again, you're going to be back next Wednesday.
Next Wednesday.
With another great show.
I think we're going to be...
I want a better show than this one.
I'm going to do my best.
Okay.
I think we're going to cover dental implants next week, which you always like.
Dental implants. That'll be great.
Yep.
All right, Jeff. Thank you for your time.
Thank
and remember,
you.
in all that you do, eat or drink, do all things to the glory of God.
It was my job to save people. Until one night, I was in a car accident. I couldn't work, and the insurance company, they fought me every step of the way. I didn't know what to do.
Call 866-YOUR-RIGHTS.
I'm Shumana Keiruz. I know what it's like to be refused your rights. When you call, my attorneys and I will fight to get you the compensation you deserve.
Jemana handled my medical benefits and lost wages, and she got me a settlement.
If you have been injured, call 866-YOUR-RIGHTS.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.